Heart attack is the #1 killer of both men and women in the United States. Usually, a person presented in a hospital with complaint of chest pressure. The pain usually radiates to the jaw, shoulder, arms, or stomach. One way to diagnose for possible heart attack is through a 12-lead electrocardiogram or ECG. Once confirmed it is a heart attack, the person will be sent to the cath lab for cardiac catheterization. Cardiac catheterization is an invasive diagnostic procedure which does a comprehensive examination of how the heart and its blood vessels function. A catheter is inserted through a peripheral blood vessel in the wrist, arm, or groin with extra guidance. This procedure is done on patients with acute coronary syndrome, STEMI or ST segment elevation myocardial infarction, or non-STEMI, non-ST segment elevation MI. This procedure has few other indications. Nurses need to know what this procedure entails to better understand the rationale of the interventions being rendered. These are the learning objectives for this presentation. After completing the class on post-cardiac catheterization care, the nurse will be able to perform the assessment of a post-cardiac cath care accurately. Vital signs, neurovascular status, insertion site, pain, and urine output must be assessed frequently. Demonstrate proper techniques of removing femstop device or TR band. A femstop is a compression device placed over a femoral artery puncture site to compress the artery after removal of an arterial sheath. A TR band has a dual compression balloons that provide compression of the radial artery. The nurse will be able to recognize at least 4 potential complications of post-cardiac catheterization, intervene on recognized complications without hesitation, identify 3 reasons to call the doctor. Few complications are hematoma, retroperitoneal bleed, thrombus, and arrhythmia. The cardiologist must be notified after attempts to resolve the complications are unsuccessful. These are the learning goals. The nurse will gain knowledge in the assessment and management of a patient who underwent cardiac catheterization. The nurses will be comfortable in giving safe care on their patients after cardiac catheterization. The nurse will be able to teach their patients regarding post-cardiac care while in the hospital and on discharge. Discharge teaching is a continuous process. It is the duty of the nurse to provide this information to the patients. Why is this education needed? This can be used for the orientation of newly hired nurses and seasoned nurses who transfer from other departments to the intensive care unit. Our facility has 3 adult ICUs, medical ICU, surgical ICU, and coronary care unit. It is obvious that all patients who had cardiac cath go to CCU. There are times that patients go to the other units where beds are available. In this case, the nurse might not feel comfortable caring for this patient due to lack of training. This is why it is important to present this teaching presentation project to all ICU nurses, regardless what unit they are assigned to. Another need is due to the incomplete documentation of the assessment. The assessments must be documented according to the prescribed frequency. For example, the insertion sites and pulses are monitored every 15 minutes times 4, then every 30 minutes times 2, then every 2 hours times 2, then every 4 hours, and they should be documented as such. Another reason is lack of knowledge regarding complications of post-cardiac catheterization. Poor patient outcome can be a result of unrecognized complications. Failure to follow through the doctor's orders. One of the initial order is to get an initial EKG after heart cath. It is important to determine the status of the heart. The nurse must recognize any changes and must be reported to the cardiologist right away for any changes. Another need is unfamiliar devices used to stop bleeding in the insertion sites, and they are the fem stops and or TR band. The teaching strategy will be a combination of lecture using PowerPoint with visual aids, role play, and case scenarios. This approach will increase student interaction and student satisfaction. This type of approach seems to accommodate the visual learners, oral learners, read-write learners, and kinesthetic learners. The first teaching strategy is the lecture. Using a lecture as teaching strategy is the safest and easiest method. Basic facts are communicated, new concepts are introduced, passion on the topic is conveyed. Use of provocative lecture where the instructor does most of the talking but provokes students' thoughts and challenges their knowledge and values with questions. The general information, postcard, catheterization orders, assessment, and potential complications will be included in this lecture. The next teaching strategy is the role play. Role playing is usually used in competency skills. Feedbacks are provided immediately. The learners have an opportunity to become actively involved in the learning experience but in a non-threatening environment. The nurses will have the opportunity to demonstrate the removal of femstop or TR band compression devices. And lastly is the case scenario. Problem-based learning is an educational process where learning is centered around problems. Nurses can benefit from the use of PBL to stimulate realistic clinical situations. Nurses can work in groups to discuss the scenario given. They can discuss the signs and symptoms, interventions, and rationale of the interventions, and when to call the doctor when complications are observed. In conclusion, educating nurses on post-cardiac catheterization care is important to increase awareness of potential complications which can lead to good patient outcome if managed immediately. Patient education must be implemented on the day of their admission to the hospital to increase compliance on treatment and prevention.